Good morning. Dr. Wells here from Nutritional Physical Therapy. I got a cool research update. This is a good one for our sports PTs, some of our strength and conditioning coaches, athletic trainers, and even outpatient PTs. The publication was in Acta Physiology, the Oxford edition, 2024 of October, so just last month, hot off the press. Javier Diaz Lara is the primary author. He's out of Toledo, Spain, one of my favorite places in Spain, along with some other colleagues from Australia. And the title was, Does Delaying Carbohydrate Consumption After Exercise Impair Exercise Performance the Next Day? Cool thing about this is a double randomized controlled trial. So in other words, and it's crossover too. So in other words, the people that get to try one variable also get to try the next variable, so you get to see a good comparison between the two. Total subjects were 9, and the reason why the number is so low is that this study has to look at muscle glycogen. In order to look at muscle glycogen, the authors have to actually go in and do muscle biopsies, which can be really painful and hard to recruit for. Regardless, what the authors did, and it's interesting because right now there's a lot of debate about carbohydrate availability and whether we need it, whether we should push our athletes to not have a lot of carbohydrate availability for certain workouts. And we talk a lot about that in our nutrition courses, particularly our third course. But the interesting thing with this is these authors took these 9 active men. Average VO2 max was around 46. And what they did is they did a high intensity interval training program. So they effectively did cycling, 10 sets at 2 minutes, 94% max power. So they were pretty exhausted afterwards. After that, they then said, all right, are we going to put them on a regular carbohydrate sort of regime? So that's in that 3-hour post exercise period. They would get 2.4 grams of carbohydrates per kilogram of body weight. Or would they get a taste-matched, non-caloric substitute, basically not allowing them to have carbohydrates in that 3-hour window? And what they did is then 24 hours after recovery, they repeated the bouts until exhaustion. So in other words, you're going to cycle for those 2 minutes as hard as you can, as many times as you can, with a 1-minute break in between. And what they found is those athletes that did get that carbohydrate meal within that 3-hour window after the first bout, they were able to do 17 rounds of the high intensity interval training, compared to those that did not get the carbohydrate. They only did 13 rounds. So they were able to do 4 more rounds of high intensity exercise the next day. Interestingly, the rated perceived exertion was also better in those that had the carbohydrate 3 hours after that first bout of high intensity interval training. So what does this mean? Well, it means that carbohydrates are essential for recovering, particularly from high intensity exercise. We talk a lot about that in our courses. We talk a lot about the importance of carbohydrates for athletes, particularly in this current social media epidemic of everyone needs to be low carb, everyone needs to be low carb. I argue not necessarily. Some people it works for them, but obviously in this case, for high intensity athletes, it does impact their performance, particularly the next day. So interestingly, when the authors looked at the muscle biopsies of the athletes, their overall muscle glycogen wasn't that low. However, when you dive into the data, what they suggest is they were doing total muscle glycogen. And what they suggest is that because this was a higher intensity exercise, the other data points have shown that type 2 muscle fibers, like from doing squats and deadlifts, tend to use that muscle glycogen up faster. And so there's certain areas within the muscle that muscle glycogen might be used more. For instance, in the intramyofibular space versus the extramyofibular space. And so in other words, they were suggesting that the muscle glycogen might be depleted in one area of the muscle more than another area. And they just basically did a larger test of overall muscle glycogen, which was lower, but just not statistically lower. So all this to be said, there's more research that needs to be done, but what we need to look at as physical therapists is encouraging our athletes after high intensity interval training is to get those carbohydrates, protein, get food, right, within that 3-hour window after exercise, particularly if they're going to go hit the gym or the field again the next day. Hope you like this information. If you do, please like, subscribe, check out our courses at nutritionalphysicaltherapy.com, and make it a great day.